Welcome, everyone. Thank you so much for logging in to our presentation, A Closer Look at Healthcare in a Continuing Care Retirement Community. This is one of my absolute favorite panels because it uncovers the mystery about what a CCRC is, and very specifically, what you are offered when you move to a community like Birch Hill in Manchester, New Hampshire. So we've got our entire healthcare team, leadership here, ready to answer your questions. I'm just gonna go through a few housekeeping notes. If Kim can move the slide. All of our guests are on mute, but we welcome your questions. If you would like, log on to the Q&A section and add your questions as we go along on the bottom of the screen, and we will make sure to answer them before the presentation is done. As always, we're newish to Zoom since March, and so any way that you think we can improve this, or if you have another topic you'd like us to cover, add that in the Q&A section too. We are recording today, so if you'd like to share this webinar with someone who hasn't been here, we will be sending you a recording of it. And we're good, Kim? For those of you who may not be familiar with who we are part of the Riverwoods Group, which is the largest family of nonprofit CCRCs in Northern New England, comprised of a cluster in Riverwoods, Exeter. We started in 1994 with our first community in Riverwoods. We have 2 other campuses in Exeter. We affiliated with Birch Hill in 2016, and in 2019, we opened our latest community, Riverwoods, Durham. And then we have this very official SPE, which stands for Someplace Else, which means that our community and our family of communities is committed to growing and bringing this way of life to as many people as possible. And we can go to the next slide. Some people may not realize that a CCRC is actually an insurance product. So we look like a beautiful condo community or apartment community, but actually a CCRC is regulated. Their contracts are regulated by the state in which they operate. So the Department of Insurance in New Hampshire regulates our contracts. We report our financial performance to them on an annual basis. You can find audited financials of Birch Hill on our website. And because we are an insurance product, the government considers that when you move to a CCRC, you are prepaying or insuring for your potential healthcare use. So a portion of your one-time entrance fee and your monthly fee are tax deductible. So when you join Birch Hill, you sign a contract and we agree to provide your housing and nursing needs for the rest of your life. And generally you're going to live longer in a CCRC than you would if you were living at home. But it's also a lifestyle choice. So it's a chance to come in when you are independent, you need no assistance, but you have an easier life. You don't have to worry about home maintenance. You've got transportation help. You've got fitness classes down the hall. You've got more opportunity for social interaction. And the most important thing, you stay in control of the choices in your life. What do I mean by that? We know that a large percentage of us are going to need long-term care at some point. If you move to Birch Hill, you know that you will get care when you need it by a team who knows you right down the hall. So you have stayed in control of those important choices. You're not letting someone else make those decisions. So for those of you who may be new to this idea, a CCRC, you have to enter when you're 62 or better. You have to enter when you are independent, and generally you get 3 levels of care: independent, assisted, memory care, and nursing care. So 4 levels, 3 in the health center. We have services and amenities at every level. And typically there are 2 fees, 1 entrance fee and 1 monthly fee, which, as I mentioned, a portion of which are tax deductible. How do the prices differ? Very simply, the larger home you decide to choose, the more costly your entrance and monthly service fee are. You have an opportunity to have a bigger life if you choose to move to a CCRC. And we also have benevolence at every nonprofit CCRC, which means if through no fault of your own you outlive your assets, you can apply to the community for benevolence. So Birch Hill has been around for a long time in Manchester. It became a CCRC in 2009, joined the Riverwoods family in 2016, and since joining the Riverwoods community, we've invested a significant amount in the physical plant. We have moved a lot of apartments and completely renovated them. So the advantage to Birch Hill is we have immediate occupancy, which very few CCRCs have right now. Also, we are a Type B contract, which means we are generally much more affordable than a Type A contract. And if you haven't seen us, we are in a beautiful location, 10 minutes from downtown Manchester, right next to a 600-acre nature conservancy. And we are doing socially distanced and safely monitored tours. So you can come in for a tour if you're interested. We have a brand new 70% contract. This is the only contract of its kind in New England. It is a very smart financial decision. So most CCRCs have a refundable contract, which means a portion of your entrance fee is refundable to you once you pass away. It's refundable to your estate once you pass away. And we have resold the unit. At Birch Hill, last year we got approval from the state to have a flex 70% contract. What this means is you have a one-time entrance fee, but you can pull down from your refundable entrance fee while you are alive to pay for costs in healthcare. So what that means is you have more predictability in your cash flow because you have this pile of money to pull from when you need it most. You can use your existing long-term care benefit if you have that, but you have the access to money during your lifetime as opposed to simply an estate preservation. It's predictable and it's better value. So that's something else we've innovated. In terms of COVID and my team here, we'll talk about it in much greater detail, but moving to a CCRC during this pandemic is a really smart idea because we are better equipped. We have professional nursing staff and housekeeping staff. We have access to PPE, sanitizing wipes, testing. We are extremely aggressive about safety. And during the most significant times of COVID, we make your life easier. If you need groceries, meals, prescriptions, we make that all happen for you. You don't have to worry about going out and endangering yourself. We also have a wellness clinic, which you can access during your time here. So it is a very, very first-rate place to be because you have all that access. We listen to CDC calls and Department of Public Health calls on a daily basis, monitoring the situation. And we have a lot of confidence and experience going into this. And now we are meeting the dream team. So you are meeting a number of folks at Birch Hill who are the leaders of our healthcare team. And they are each going to take several minutes and talk to you about what they do and how you might interact with them at Birch Hill. And we're going to start with Vicky Patalis, who's a nurse practitioner at our wellness clinic. And the reason we have the order that we do, this is the order in which you would interact with them. So I'm going to mute myself and have Vicky introduce herself to you. Vicky?
Perfect. Thank you, Kathleen. Welcome everyone that's on the call. My name is Vicky Patalis. I am the wellness nurse practitioner here at Birch Hill. It's a little funny for me to go first because I'm actually the newest member of our team. I just started here at Birch Hill in May, but I couldn't be happier. And I tell them I'm not going anywhere until they push me out. So a little bit about me is that I have been a nurse for over 20 years. I got my nursing degree from Northeastern University. Immediately out of school, I used the co-op program at Northeastern and took my first job at Mass General Hospital in Boston. I sort of lived the dream nurse job to me in my 20s. I worked the night shift. I was in the ivory tower. I loved every bit of it. But then I got a little bit more serious, maybe grew up a little bit and bought a house on the seacoast of New Hampshire. I did that commute to Boston for a little bit, but I couldn't hold on to it for that long and wasn't really ready to go to a smaller community setting. So I always say I went and did pharmaceuticals for a little bit, but I quickly learned that that wasn't who I was. I was a caretaker by the bedside or alongside people. So I went to the local community hospital here on the seacoast. I worked in the ICU where I got tremendous experience and loved it. I started my family. I have 2 boys, and kind of the beauty of nursing is that you really can kind of ebb and flow and go where you need to, schedules and specialties. So I had some really great experiences. I worked in the ICU. I did a little bit of school nursing. I taught in a nursing program. I was a fitness instructor. I was passionate about nutrition. Ultimately, I ended up back in that ICU though, because I loved putting the pieces of health together. And that's what the ICU afforded me. But then my boys got a little bit older. I was still working the night shift and I saw an ad for a wellness nurse, which completely struck me. That seemed to be everything I believed in and was passionate about. It was at a little community in Exeter, New Hampshire. You might know about it. It was called the Riverwoods. And I went and applied for that job and got the job as the wellness nurse there under their wellness nurse practitioner and completely fell in love. Fell in love with the ccrc, knew this was the population I wanted to be with, and actually knew that was the job that I wanted, my boss's job. So that prompted me to go back to school and get my family nurse practitioner, which I got at Simmons University. And then I kind of went out and did what I felt like I needed to do. I worked in family medicine. I also did some addiction medicine and served all populations, but knew that ultimately I wanted to work with an older population. And truth be told, I was really waiting for my old boss to retire. But before that happened, this opportunity popped up at Birch Hill and I sort of came here and wouldn't let them say no to me. So I felt like I was coming back where I belong. This is where I grew up as a kid. And I knew the community and this is where I wanted to be. So I've been here since May. I absolutely love it. And I am the first person on the panel because I might be your first interaction with the team in that I would do your health entrance assessment. And I've heard before, some people say, oh, we were so nervous to meet with you, or that seems a little bit scary. And what you really need to know is there is nothing to be nervous about. There's nothing to be scared about. Kathleen said earlier, we really want to get to know you so that we can support you and you can live your best life here. You're not a chart here, you're a person. And we use a 3-prong approach when you come in to do your assessment so that we have a baseline. I understand what you need. When you say, Vicky, this is what I want to do, we know that we can support you along, I can do that alongside the rest of the team. So the entrance assessment, like I said, is 3-prong. It takes about 30 minutes. Zoom's been my friend doing this, and I actually think it's a blessing if there's ever a silver lining that we can keep doing entrance assessments, and we can do it with this technology. When we get to the point that we can do them back in person, we will do that again. But they're wonderful. Honestly, they're a tool. They're a foundation. They are the beginning of your wellness chart here at Birch Hill, if you choose to come. And it's really nothing to be afraid of or intimidated of, or no pits or butterflies. Once you get through that and you choose to come be at this amazing place, I say that the wellness clinic is really like the school nurse. So I am not anyone's primary care provider. You are required to have a provider in the community, which is one of the roles I serve. I'm happy to help you connect if you're coming from out of town. I can help you find local primary care providers, local specialties. We have great medicine here in Manchester. We have 3 big networks and I can help you connect with that. But I'm an extra set of eyes, ears, someone to talk to, someone to call on the phone and say, you know, this is how I'm feeling, or this isn't quite right. And from there, we can talk it through. I'm a certified nurse practitioner. I can say, hey, let's sit on this. Let's put this plan in place. Or, you know what, I think maybe you should get in touch with your primary. I could direct you to urgent care if need be. But like I said, I always call myself the school nurse. I am here to support you and live your best life, because that's what you're going to do when you get here. But you're going to have your own providers in the community. So that being said, those are my two major touch points. And I am going to roll this over to Tasha, who is our Director of Community Life, who she, just so you know, is supporting my passion for wellness. In one of her upcoming events, we're going to do a community fun run, which to me kind of embodies all of wellness. So I love working with Tasha and her team.
Hello, I am Tasha, as Vicky said, Director of Community Life here at Birch Hill. I've been here for about a year and a half now, and I come here from Vermont, where I was in a job that I absolutely loved. I started out in Vermont. I worked for 10 years in home health, and then I landed in this wonderful nonprofit that had 3 different communities, and I was the director of resident programs there. So, and I was their dementia care educator as well across all 3 campuses. I have a huge passion for resident engagement. It really is about the best gig in the world. Vicky says hers is the best gig. I think mine is. I get to make sure everybody's having fun. No matter what your fun is, no matter how you find joy, it is my job, along with my team, to make sure that you find that joy. Some people want to be involved in absolutely everything and do everything and participate and start clubs. And there are other folks that move into the community and they want a quieter life. And it really is up to you. You are able to drive that. My job is to make sure that you have the opportunity to do whatever you wish to do here. When somebody moves into the community, we encourage them to tell us, you know, what brings you joy? What do you love? And chances are, if it's not going on already, somebody else in the community is going to want to join in with you. Recently, we had a new resident moved in probably 8 months ago, and she said, you know, Tasha, I have this huge interest in genealogy. And I've been talking to some other residents and they have the same interest. So we would like to start a genealogy club. I said, fantastic. So the ideas come from residents. They are resident driven, and we just do whatever we can to support those opportunities. We also have a really active fitness program. We have a fitness coordinator, Bernadette, who is notorious in these parts for getting all kinds of people inspired to do anything from yoga classes to strength training classes, balance, exercises. We have a bar class that started many months back with, there's a resident who had always practiced ballet, and she and her daughter ended up leading a bar class that took off like gangbusters. So again, very resident driven. We have lots of concerts and events, and of course that's a little bit different right now, but I'm really happy to say that we have figured out how to do things virtually. We're having virtual concerts. Presenters that used to come into our community want to keep serving this community because, just like me, they landed here and love it, and they want to make sure that the residents stay engaged. We have a lot of resident clubs. We have a beer and wine tasting clubs. We have, oh my goodness, we have knitters, we have hikers, we have bikers, we have all kinds. And it really does give us different folks from different places, give us the richness of this community that is so very special. Really active gardeners as well that enjoy both raised beds and also helping around the property. Folks that have left really big homes and missed gardening. So we said, let's figure this out. Let's create more spaces. And that's exactly what we've done. We have really lovely library and folks that are volunteering and doing all sorts of collectors and you name it, and we're doing it. And the great thing about engagement at Birch Hill is that, like I said, it's dynamic. It's always changing. For residents who are living in our health center, we have lots of opportunities happening there as well. Again, we have smaller groups happening, but there are many things, both seasonal and every week there is music, there is art, there is anything we can do to bring joy. We want to give that opportunity. So I look forward to any questions that you might have about any of the engagement happening at Birch Hill. And I am going to pass on to, at this point, I believe is Cindy Martin up next. Kelly Spiak is up next.
Yes.
I apologize. Our
That's
lovely
okay.
Kelly Spiak, social worker extraordinaire.
Hello, I'm Kelly. I am the social worker for the Birch Hill community. I've been at Birch Hill for just over 2.5 years now. And prior to being here, I was a social worker as well at a nursing home in Massachusetts. I graduated from Plymouth State University in 2012, and then I got my social work license. One of the biggest things that I assist with here is residents transitioning. So whether that be when you first move into Birch Hill in independent living, or when you may need to move over to the manor, or even if you just need a temporary respite stay in assisted living. So sometime when a transition may happen is after a hospitalization or a rehab stay. If you need any assistance after being hospitalized, or again, after being in a short-term rehab facility, you can reach out to me at any time and we can figure out together what would best suit your needs at that time. So in the manor, we have assisted living, memory care support, and nursing home level of care, which Amy, our Director of Health Services, will give you more details about. We also have, as I mentioned, 2 respite rooms, which is in our assisted living area of the manor that independent residents can access temporarily. That's usually after a hospitalization or a rehab stay, but that can also just be if you're simply not feeling well enough to be alone in your independent apartment at that time. So paperwork does need to be completed both by the resident and your primary care doctor in order to do a temporary respite stay, or even if you're moving to the manor permanently, and I can help you with that at any time. The manor is also a great space for spouses if they're in need of any extra assistance. So sometimes if one spouse might need a little bit of assistance, both can still move to the manor together, stay together in an apartment, and just get that extra assistance when needed. So we have a lot of options. And transition discussions are always done with, of course, at least you, the resident, me as a social worker, and oftentimes families involved as well as Tasha, Vicky, and Amy, who you're all meeting today. So I think that's all I have. So I'll introduce Amy Reynolds. She's the Director of Health Services over in the manor. Thank you.
Thank you, Kelly. Hi, yes, I am Amy. I am the Director of Health Services here at the manor, which Kelly was referring to. We are also the health center here at Birch Hill. I have been here for, oh gosh, about 18 years. My educational path started quite differently. I graduated from high school and had a passion for English, but lived with a roommate who had a passion for nursing. And as it turned out, her passion became mine. So I was fortunate enough to work my way through nursing school. Much like other nurses, I worked full-time as a nursing assistant. And I think that's really truly developed my love and drive to work, taking care of people, meeting people where they're at with their level of care and their care needs. And my career here at Birch Hill kind of has evolved. I've kind of grown up a little bit here. I started off actually as a part-time evening nurse, and now I have the pleasure of kind of overseeing the department, which is a blessing. I am surrounded daily by people who are passionate about providing wonderful care, nurses who come into work and love being here. You know, we truly refer to ourselves, we are a team, we are a family. I think what distinguishes us from other communities is that we really feel like this is quite home-like, both obviously for residents who live here, but for the staff who provide the care. Vicky mentioned that, you know, we view people not as charts or illness or age, but just simply by the humans that they are and the great contributions that they offer to our community. Everybody is so unique. And it truly is, as a staff person, a blessing to get to know so many people with such rich diversity and histories that are just so amazing. So our goal here in assisted living is really to keep people supported at a care level that is as independent as possible for as long as possible. We look to maintain independence, and obviously, you know, everyone has hiccups in healthcare and in their health along the way. And what we do as nurses and LNAs is step in when people need a little bit of extra assistance. And we are here to care for all of those needs. Kelly mentioned that we do have a few different levels of care here at the Manor, at the health center. We are mostly assisted living. We are licensed for 70 assisted living beds. Among those assisted living guidelines, we also have a very small kind of unique, intimate memory care community, which is lovely and vibrant and active. We also have a long-term care section of our building, which is strictly nursing care meant for long-term, very much like it sounds. And also under assisted living guidelines are the respite rooms that Kelly was talking about, where people can come and stay for a couple of days, for up to a month, to regain strength, to start feeling better if they're recovering from an illness, really just to get the support that we can provide when they need it. We oftentimes have rooms available, so we welcome people to come and stay. It's a great kicking off point to kind of see what we offer over here in the health center. And so we are very fortunate to meet people oftentimes from independent living prior to a need that they feel may be, you know, in the decision making to actually move in here. We are very, very fortunate to have this team of wonderful people that you're meeting today. You know, I've been certainly very fortunate to have been part of Birch Hill's journey. We've come from great places, and I think that we're destined to go even further. We are, you know, we are just a group of really enthusiastic, wanting to do our best caregiving and meeting people's needs. We're very person-centered. We are, you know, just absolutely looking to do the best thing for as many people as possible. You know, so we start off when people need transitions, we start off with things as small as just medication administration, right up to activities of daily living. We're here for pretty much anything that you need, 24 hours a day, 7 days a week. So that's about, I welcome any questions, certainly. Most often, we love to do these little chats because the questions are always super, engaging and kind of wonderful. But I will now hand off to Cindy Martin, who is perhaps one of the most brilliant people I've ever known. She is the Vice President of Quality at the Riverwoods Group, and I have the pleasure of working with her quite often. So Miss Cindy.
Well, thank you, Amy. I think that is not well-deserved, but very kind. Thank you. My name is Cindy Martin, and I am the Vice President of Quality for the Riverwoods Group. I'm a registered nurse and have worked in healthcare for about 30 years now. I'm hoping nobody's doing the math on that. I've practiced in emergency services, home health, long-term, and rehabilitative care primarily. I have also taught nursing skills at one of our local community colleges, had a lot of fun doing that. I've been with Riverwoods for about 16 years now and started as the director of nursing at our Riverwoods Exeter campus, where I opened up a new health center, The Ridge, which was a tremendous amount of fun. And after about 7 years, I moved into the Vice President of Health Services role, really where I was providing support and oversight to all of our campuses in Exeter, overseeing nursing, social service, life engagement, our rehabilitative team, as well as our wellness clinics with our nurse practitioners. For the past just a little over 2 years now, I have been serving as the Vice President of Quality, which really means I've been working very closely with the Birch Hill team, as well as our entire family of communities. This has provided me really kind of a unique opportunity to be a resource and I guess I would say a conduit to share best practices and ideas amongst our teams. And, you know, while I work primarily with the staff, I've had the opportunity to also work with some of our residents on quality projects, which has been a lot of fun. And they've been kind of wide ranging. I worked with some residents who were very interested in, you know, how do I make sure that my wishes are known, you know, if and when I cannot speak for myself. So we created a kind of a project which was called Speaking for Myself. And we had a number of residents who participated in this just to make sure that, you know, their lifestyle choices and their routines would always be honored if for some reason they, if and when they needed healthcare, that they could not speak for themselves. I also worked with a very energetic group of engineers on working with putting in acoustic loop technology into dining tables so that folks who maybe had some hearing challenges could have a more desirable dining experience. So I've had a lot of opportunities to work with residents on quality projects, and that's always a lot of fun for me. In the day-to-day, I really provide support for our teams to focus on our collective goal, which is to support all of our residents to really live their best life, however they define it. I also spend a significant amount of time navigating regulatory compliance and rules and making sure that we have all the information that we need to be compliant and the guidance that we need to support our teams. And hopefully I simplify that for our teams so that they can spend more time on what matters, which is really serving our residents and their families and each other. I do work also very closely with our medical director who provides on policy and procedure and best practices and assuring that our care approaches are always based on the most up-to-date evidence-based practices. So one example of what I do as a Vice President of Quality, I guess more recently, is to provide support in our COVID approaches. This involves, I think Kathleen kind of alluded to this earlier, a lot of participation on a nearly daily basis in calls with the CDC, the Department of Public Health here in New Hampshire, New Hampshire Department of Health and Human Services, as well as Leading Age and others. And this is important because, as I mentioned, we certainly, you know, being the most up-to-date frequently as we learn more about COVID. And certainly this year we have collectively here at Birch Hill, and I think everywhere, learned a lot about COVID over this past year, and we continue to learn. So from these calls, I'm able to share kind of the ever-changing guidance with our teams. I also work closely with our teams to make sure that we have appropriate levels of personal protective equipment. And I got to tell you, that's something I never thought that what I probably utter from as a nurse, wondering if we might have appropriate levels of personal protective equipment. But given some of the challenge over this past year, we certainly had to be creative in how we were making sure that we had what we needed to be safe. And we did so. So I think, you know, this is really an area where being part of a system, part of a family of communities has really been beneficial to make sure that we have the resources to mobilize quickly when things change to help with whether it be staffing or personal protective equipment or whatever it might be that we need in order to ensure quick responses and quick reactions as needed, when there may be a concern. I think the last thing that I probably would want to share with all of you today is that my role is certainly made all that much easier by the wonderful people that have joined me here today in this panel. And with that, I would pass this off to Kathleen and team and welcome your questions.
I think I am back on now. And just want to say thank you so much to everyone. I just want to reinforce what Cindy is saying, that one of the things that you're missing in not having this be a live session is the great banter and interaction. This team is a fantastic, talented, and very, very funny team that you're not having an opportunity to see because they just do a wonderful job. I had the privilege of being able to interview a number of nurses yesterday for something completely different. And what they said that they loved about Birch Hill were two things primarily. One is that they felt so supported by each other and the leadership, that every single nurse who works at Birch Hill felt that she came in to an environment of people that really cared about her success and helping her succeed every single day. And the second thing that they enjoyed most, and we've alluded to this here, is the person-centered care. And what that means is you are the center of your care. It is not designed for our efficiency or our flexibility. So it's not designed that everybody gets up at the exact same time and gets medications at the exact same time. It's person-centered. If you want to sleep late and stay up late, you can. And you eat when you're ready to get up, and you have medications when you're ready to get up. And the fact that we have that, and we have all private rooms in the health center, really helps to create that sense of home. And every nurse also said that what she enjoyed was knowing someone, knowing who they are, who each person is and their story and their family, and getting to know them as people when they're caring for them. So it is such an incredible team here that I am in awe of the talent that is in front of you. You all do such incredible work, and that is above and beyond. That's even before COVID. So I'm very grateful that we're being allowed to have an hour of time for them to share with you what they do, because they don't get enough recognition. So I'm very grateful. We have questions that are popping up. So I'm gonna start taking some of the questions. And for those of you who are on our Zoom, just go to the Q&A box and type in your question there, and we will be here to answer the questions. The first one that I'm reading is, please discuss the 70% flex contract a bit more. How much is refundable to your heirs or you when you leave, assuming you don't use it for healthcare? Also a question about long-term care insurance and CCRCs. Is one type of contract, A, B, and C, better than another to work with a good long-term care insurance policy? Please explain how each type of contract works with long-term care insurance. So I would suggest, Michael, that you sign up for our CCRC 101 event that's coming up soon. I do a deeper dive into contracts there, but just to answer your question, at Birch Hill with our 70% flex contract, 70% of your original entrance fee goes back to your estate. If you leave the community, you pass away, 70% of your original entrance fee goes back to your estate, to whoever you designate, once you pass away and your apartment is resold. However, with our flex contract, you can access that 70% refundable amount, 70% again of your original entrance fee. So it depends on what your entrance fee is. You have 70% of that. You can access that during your lifetime to cover healthcare costs. And you can also use your long-term care insurance to supplement that to cover healthcare costs. And the short answer is the best contract to use your your long-term care benefit is a Type B. In a Type A, that is 100% covered healthcare costs, so you don't really need a long-term care contract. But a Type B is the better place to use your long-term care insurance. You will absolutely use it. So that's a short answer to that question. And if you have additional questions around contracts, feel free to email me directly and attend the CCRC. Okay, another question from Richard. If a resident from independent living area meets with Vicky, does Medicare cover the cost? And Vicky, do you want to, I think that generally the answer is yes. Do you want to take that question and just talk about a few things that residents in independent might stop in to work with you on in the wellness clinic?
Sure, sure. So first of all, the direct answer to your question is you are not billed when you stop in the wellness clinic here at Birch Hill. So I am a service here at Birch Hill. I am employed by Birch Hill. So it would be a conflict of interest if I was employed by Birch Hill and then I billed your insurance. So the wellness clinic, we offer services anywhere from, I'm going to tell you right now, the hottest service in my clinic is toenails. I never knew how passionate I could be about toenails. But previously, we had a podiatrist come in, and for the safety of the community, we've really evaluated who we want here on campus. So I have upped my game and I have taken over that service. So that is just one that I offer. But in all sincerity, literally, I get calls from, I changed up my medications and this is how I'm feeling. Could we do a medication review? To, hey, I was working out with Bernadette and I think I really pushed myself a little bit too hard. Can we talk about that? To, you know, I'm just not feeling right before I call my doctor. Can I run something by you? Anything. I mean, I am happy to talk specific about medical, kind of talk about your goals, about your wellness. Really, it's all encompassing here. And like I said, it's a service here at Birch Hill. It is not something that we bill. It's an extra stop, and it is to support you, to keep you safe, and to keep you living your best life and where you want to be. And I hope that answers the question. This is what's hard about Zoom. I can't get feedback if I answered your question.
No,
Right?
Vicky, I think that's great. I love the idea of the wellness clinic. It is like your own personal, as Vicky says, your own personal school nurse. So you come in and say, does this rash look weird to you? Or I have a sore throat. Do you think? It is such a gift to you to be able to have somebody smart that you can talk to. I mean, I usually talk to Cindy, but now she's not here, so she can't look at my weird rashes. Thank God for her.
I have.
But who wouldn't want a nice, friendly, reliable person that you can say, is this something or not? And as we all get older and we have more complicated things going on and multiple medications, just being able to stop in, talk to someone friendly who knows you, who knows your medications before you have to go through and schedule a doctor's appointment. That's huge. That's really huge.
Yeah. Can I just add to that, Kathleen? I mean, you know, we probably all feel that you know, our blessing and benefit is working within the resident's home. But I think for a resident to have these services available and be able to address something before it becomes a much larger issue. Because people often wait, oh, you know, maybe I don't need to quite go to my primary care. And that's not always the best choice. So to be able to have these touch points, whether it be Vicky or Amy, the rest of the team, is really quite a benefit.
No, absolutely.
And I'm going to add on to that one other thing.
Yeah.
Tagging on to Cindy is, another benefit of this community is there are so many eyes and ears looking out and for you and your well-being. And there is such an amazing team, especially now in the pandemic. One of my biggest concerns is obviously physical health, but mental health as well. So it is not uncommon that, you know, Tasha can come to me and say, hey, so-and-so always shows up to this class and they're not there, and that's off, you know, and something's off and we are looking out for you. Or Kelly can come to me and say, hey, got a call from a family member. Can you just do a wellness check on so-and-so? And it just, I mean, it doesn't stop at our healthcare team. I want you to know that, you know, foods, you know, our dining room, our housekeepers, facilities, they are so involved. And that being said, I don't want you to think we are a smothering community. By no means do we smother. I always say respectful and independent. We respect your independence, but we are so all in and invested in you that it's just, I say it because I'm very proud to be here and do that for our residents.
Yeah, I agree. It's a community where you matter and how you want to live matters. And everyone here is, their role is to make your goal, as someone, I think Cindy or Amy said, to help you live your most independent life in the way you want to live it, whether that's super active or more quiet and introverted. That's what we're here to do. And we're here to answer more questions. So I have questions on from Michael on spouses and assisted living. If one spouse in a 2-bedroom has to transfer to assisted living or nursing care, can the other change to a 1-bedroom apartment that comes with lower monthly fees? So I think one of the beauties of a CCRC is that nobody ages at the same rate, nobody gets sick at the same rate. And if you are in a CCRC and your spouse needs care, you, the spouse, are not the caregiver. You are still the spouse. And your partner goes to the health center where they are cared for, and you can go back and forth down the hall to visit them as much as possible. And I also want to make a point that in independent living at Birch Hill, you have 30 free days every year that you are an independent to go to the health center. So if you have a tough winter and you get pneumonia, as I often do, and you need a little help, you can go into the health center for a little time, get stronger, and then come back to your independent apartment. A lot of people don't realize that. That's the beauty of a nonprofit, is we are not clubbing and dragging you by your hair, as Cindy would say, to go to the health center. It's a conversation between you, Vicky, Tasha, Kelly, your family. You know, when does it make sense for you to go? And you can go and spend a little time and then come back. So you can go back and forth. In terms of if you would like to move to a smaller apartment, we have an internal move policy. So that is governed by how many sales we have externally and how many moves we can make internally. So I would say it's not typical for someone to move to a smaller place once a spouse moves into the health center. It could happen, but generally it doesn't happen because that is your home. And it is, it occasionally happens when you move into independent living that you move to a smaller place, but it's not typical. It's not what we typically do. We decide, you like your home, and that's where generally you stay. And another important thing to note is that when you move to a CCRC, 2 people are not twice as expensive as 1 person. The second person monthly fee and the second person entrance fee are a fraction of the first person cost. So that makes a significant difference. Kim, I think you said those are the questions I have in the Q&A. I think you said that you had some that were emailed to you. We have time for maybe one more.
Yes, I did. I had a few come in at the time of registration. And the one was just talking about 24-hour emergency response and what that looks like. I think Kelly brushed upon that a little bit.
Yeah, so here at Birch Hill, we have an emergency call system and pull cords located within each living accommodation here. So whether that's an independent or in the manor, and each resident is also given a pendant that you can wear at all times should you choose. Any emergency call received from the resident will be answered 24 hours a day, 7 days a week. During these COVID times, we've had to pivot a little bit to ensure that we're keeping all of our residents safe by keeping staff kind of separated from independent and the manor. But we're always able to ensure that you have access to the care, and whether that's 911 or a follow-up visit with Vicky or I or whoever on the team, that's available.
Okay, another question, I think is for you, Vicky. I know you talked about seeing patients or seeing our residents in their homes, but could you talk a little bit about provider collaboration?
Yes, can you hear me?
Yes.
Okay. So one of my big jobs is to stay connected with the providers in the community. And truth be told, I think my experience in family medicine prior to coming here, this is where that has been invaluable because I understand the workings of the office. And so in the past, when perhaps I could have just sent over a little fax or picked up the phone and called the office to communicate something that we see going on here, it's not as easy. And I understand that. I understand the workings of these offices now. And so we're really working to build the connections and the relationships with the providers in the community so that we can get a little bit more direct access and let them know what's going on. So for instance, if I know a resident was evaluated in the emergency department and came back to their independent apartment and was advised, say, that they needed some physical therapy, but that didn't happen because of the way the healthcare system works on their discharge. It's great because I have relationships now where I can call over to their provider and let them know, hey, so-and-so was seen. You haven't seen the paperwork yet. It might be buried, but they really need some physical therapy. And this is a summation of what happened, and we can get that order. So I try to work closely with them and keep the lines of communication open so that residents are served as quickly and as best as possible. Does that answer the question, Kim?
I think so.
Okay.
That is such an important role of our wellness clinic and our team to be that navigator for your healthcare needs, because as Vicky says, it sometimes does get buried at primary care. And I know that's a great service to our residents, but the primary care providers very much appreciate it as well, because we have the eyes and ears here to kind of make that entire care coordination process work for all concerned. So it's a really great service.
I would second that. As we get older and we have more specialists and your primary care and your cardiologist and your neurologist, I mean, it is easy to get lost in the cracks if you don't have someone advocating and following up. And doctors and hospitals love us because our team does not let anything go through the cracks. They are there, they're checking the meds, they're making sure you're doing your PT. It is a gift to you, and it is a gift to your children. I will tell you, as an adult child, this is a huge help to your children because they don't have to be your care manager. I see that we are coming up on 2 o'clock. I really appreciate everyone's participation and your questions. And I would just like to, I think we're good with questions, Kim?
Yes.
Okay, so I think we'll just close by telling you about our next web workshop, which if you are interested in a CCRC, This is one to attend. It is very, very popular every year. We have Keith Richardson, who's Managing Director of Ziegler, which is a national finance group who finances CCRCs, and our CFO. And they are here they will be here one time this year to talk to you about the financial aspect of CCRCs, what it looks like from a national perspective, a regional perspective, and our perspective, and to answer all your questions on financing and stability and how the CCRC business works from business side. So make a note of that. Tuesday, October 27th at 10. And registration is right on birchhillrc.org. I cannot thank our panelists enough. I am so grateful for all of you and the work that you do and the collaboration that we have. And thank you for taking the time. I know you've got lots of things to do and to focus on, and we appreciate your sharing your knowledge with all the folks today and with others who are going to be watching this recording. So thank you very, very much. Thank you to everyone for participating. If you're interested and you want to schedule a virtual tour or an in-person, socially distanced, careful tour, we are here for you. Thanks, and have a great rest of your day.